on those numbers that we have been getting in terms of the coronavirus pandemic here in the US, we do continue to see the 7-day average here in terms of new cases trend in the right direction, at least flat when you start to look at that, which is better than what we saw a few weeks ago in terms of cases going up. But there are interesting reports in terms of planning for vaccines and the guidance coming from the CDC, alerting states to prepare for a vaccine to potentially be ready by November 1st. And ask states to remove obstacles that would prevent distribution sites from opening and getting vaccines to, again, the people who need them first. And that's interesting considering the timeline of November 1st would fall just a few days before the election. And that's raising some eyebrows now. Of course, the leading voice on the coronavirus task force in Dr. Anthony Fauci has said that the timeline laid out there by the CDC in getting a vaccine out by November 1st sounds unlikely, but not impossible. So joining us now for more on the timeline as discussed. Joining us is Dr. Jennifer Pena, former White House medical unit physician for President Obama, Biden, and Pence. And Dr. Pena, I mean, when we look at this, it's an interesting timeline, obviously not just because of the election, but also because it's much quicker than what we've been discussing. And I would seem to insinuate that an FDA emergency use authorization on the vaccine would likely need to be enacted before we would get to November 1st. So what's your take on now this expedited timeline and guidance from the CDC?
Thank you, Zack, for having me. As we know now, this letter was sent by the CDC to the states and the governors, urging them to essentially remove any obstacles that would be present to prevent the distribution of this vaccine potentially by 1 November. And the letter is essentially, pushing, right, for this rapid preparation, large scale distribution of these vaccines. And now Dr. Redfield says, it's all in the effort to be prepared. It's all in a preparedness effort. And I'm all in agreement with that. I think preparation is key. I think it's very important. And I think it's important for the states to have these planning scenarios to help them get ready for something like this. But the concern is, right, that the timing is kind of suspicious. It's 1 November, just a couple of days before elections, and so waiving any sort of requirements to get this done is before the vaccine is fully tested and way before most healthcare experts expected this to happen is what's concerning. And so again, if there's an unfortunate political motivation to being this expeditious, especially as the coronavirus response is one of those most important issues for this election and for President Trump's reelection campaign, that's what raises the questions. And so you bring up emergency use authorizations. The FDA commissioner, Steve Hahn, repeatedly promises that science is going to guide all of these decisions. But as we know, the FDA has used these EUAs for things like hydroxychloroquine, right, which later had to be revoked because of both efficacy and safety issues. Most recently, the convalescent plasma emergency use authorization. Again, the results were touted as being a lot more effective than they potentially could be. And so using an EUA to allow for these vaccines to be available much earlier than upon completion, full completion of their phase 3 trials, it's what should be concerning to most people.
Yeah, and that's kind of the thing to me, too, because we think about getting any update on those phase 3 trials. We've gotten some preliminary data, but nothing peer reviewed yet. So considering the fact that it's September 3rd here and then November 1st would be less than 2 months away, what is it like? When Dr. Fauci said it's unlikely but not impossible, what do you assign the percentage chance to of actually getting one out, considering, as you said, we don't have those phase 3 numbers yet?
Right. So we know that there's 3 vaccines that are currently, getting ready or doing these phase 3 trials here in the United States. But again, traditionally, some of those that these vaccine phase 3 trials require not just 1 inoculation, but 2, and they have to be separated by, say, a month in between. And so again, as you said, we're already in September. So just from a timing perspective, it makes it difficult to believe that we're going to be able to even allow for that month timing in between to happen. And so, again, I think that I like to say, and I've said it before, pills and politics don't compound very well. And if the impetus to get this done so much quicker is to hit that November 1st time mark for election time, then that's not the right motivation. Skipping steps or doing any sort of less than the standard of review for a vaccine is not what's going to be appropriate when hundreds and millions of Americans are going to be getting these vaccines. And I should say, one of the things that's missing from the narrative, Zach, is trust, right? We have to gain the trust of the American people when it comes to getting vaccines. And I'll put a plug in for, the Hispanic and Black communities, which have been disproportionately affected by this virus, obviously the Hispanic community being my community. And I'll tell you, hesitation to trust the healthcare system in something like a vaccine that's being pushed through the system quicker than it should be is really not what we need. We need to promote education efforts so that we can target these groups of people and regain their trust and confidence in the safety of a vaccine.
Yeah, and when we talk about the warnings too, I mean, that's something that Dr. Fauci's warned about, especially when you think about a vaccine coming out too early and the risks you run of Americans never wanting to turn back to a vaccine should it have problems, even if there's a better one developed later on. I mean, it's a serious concern to have, but he's also warning now about Labor Day coming up and spikes that we've seen in the U.S. before, if you go back to the 4th of July or Memorial Day as well. Specifically, he's warning about a few Midwest states to keep an eye on here as we see that risk play out, namely North Dakota, South Dakota, Iowa, Arkansas, Missouri, among others. When you think about those risks in travel weekends here in the U.S., what do you think might be typically or concerning specifically this time, I should say, when you think about positivity rates kind of starting to trend higher as more people might be hanging out outside?
Right. So Dr. Fauci, appropriately so, is warning these states in particular because they've already started to see an increase in that percent positivity in their testing in these Midwestern states. And so that's already predictive that there's going to be a problem, as was, as happened during Memorial Day and 4th of July weekends when people just let their guard down and the cases just take, they had an uptick. We had a huge spike, especially after 4th of July. And so as Dr. Fauci mentioned, history is bound to repeat itself, but it doesn't have to. We can stop that. And it's very simple. As he mentioned, you can have an enjoyable weekend, but just do the things that we already know fundamentally will work. Wear your mask, maintain your social distance as much as possible, avoid large crowds, wash your hands, and those types of things will hopefully prevent those upticks from happening again.
Well, on the discussion of trying to do things responsibly, we're approaching the start of the NFL season. So I wanted to ask you a couple things there, as, I don't want to repeat problems that we've seen in the past, but, the NFL kicking off their season does risk that exact problem here. When we think about some teams, 5 have said they plan to allow fans back at their reduced capacity stadiums. You can look at potential 13,000 fans in Hard Rock Stadium in Florida. You can look at 16,000 fans potentially being welcomed at Arrowhead in Kansas City. So when you think about the risks around this, wearing masks in a crowded stadium, is that enough? Because we're talking about people who might be taking those masks off to eat, drink, and have to obviously come into close contact when entering the stadium. So what do you say about the NFL welcoming fans back into the stadiums amidst this?
It's extremely concerning, right? I mean, we all want to go back to some sort of sense of normalcy, NFL season being one of the most important things that Americans look forward to in the fall, and being able to watch these games, et cetera. But as we've seen already in college campuses and a lot of, sports within college campuses, when you start to group people together in these kinds of activities where inevitably people will have to take their masks off, you're just asking for trouble. And so it's hard to believe that with opening up the season, even in a limited capacity as they're planning to do, that we're not going to see an uptick in cases, and it would be tragic. And so I would have to say I disagree with that decision.
Yeah, well, I mean, we'll see how it plays out. Obviously, a lot of the other sports leagues have gone without fans, and the NFL, interestingly, could be going the other way. We'll see what happens, or if they can even complete the season. All questions that people have on top of their minds right now. But Dr. Jennifer Pena, appreciate you taking the time to chat. Be well.
Thank you.
Hey investors, Zack Guzman here. Are you interested in learning more about the markets and getting the latest financial news? Well, then click right here to subscribe to our Yahoo Finance YouTube channel. Get the latest up-to-the-minute market analysis, big interviews in the world of finance, and information on how to manage your money every day wherever you are.